It's a beautiful day. Lucky that we live Hawaii. 24/7, 365. Swimming in the ocean anytime. Take a leap, yeah, live healthy. Eat well. Be active. Live mono every day.
Take a little bike ride.
We're gonna pretend like we're talking. Aloha kako, and welcome to our 5th episode of Foundation for Healthy Generations. I'm your host, Lorilyn Salamanca, of the WIC program at the Department of Health. It is nice to be with you once again to highlight our state health department's public health programs, initiatives, issues, and public health concerns. During our last episode, we interviewed Mrs. America, Lara Leimana Fonoy Moana, and how she's working to inspire healthy lifestyles by using her influence as the current Mrs. America and promoting her Shake It Up campaign. The department's strategic plan contains 5 foundations for healthy generations. And in today's episode, we would like to highlight Department of Health's activities that support breastfeeding and how these activities close the gaps in 2 of the 5 foundations: health equity and health promotion and disease prevention. Today's episode is part 1 of a 2-part series on breastfeeding. Well, recent studies show that women who breastfeed enjoy lower risks of breast and ovarian cancer, anemia, and osteoporosis. Both mother and baby enjoy the emotional benefits of the very special and close relationship formed through breastfeeding. Not to mention it also lowers the risk of obesity and overweight. When babies are breastfed, both mother and baby are healthier throughout their lives. This translates to lower healthcare costs and reduces the financial burden on families as well as on community and government, medical programs. To give an example of how breastfeeding can impact one's life, we have a video of a mom sharing her experience.
I decided to breastfeed because I heard from Sammy Albano from the Hi'ile perinatal program. It's for teen mothers, and she actually persuaded me to breastfeed because there's a lot of benefits and it's convenient. And it doesn't cost any money, it's free, and it just brings a special bond with you and your baby. My friends have been very supportive, and I love them, they love me, they love my baby daughter. And also my cheer sisters, they're very encouraging with breastfeeding, and they're just all positive thinking, positive ideas towards me. And my coach Tita, she's very supportive because she has actually breastfed too with her 3 babies, I think for a couple of months, probably 6 months. And just all the mothers out there that breastfed inspired me to start breastfeeding my baby daughter. It's hard at this time being a teen mom, and there's not that much teen moms that I know of that breastfeed. They usually go to the formula bottle feeding, and it takes up a lot of time, and it takes a lot of patience for a mother to breastfeed her child. Some of the challenges I faced was finding the time and finding a convenient place to breastfeed my daughter. But good thing at my school we actually have a free nursery, and all of the daycare workers there, they're very supportive, and they help me out a lot, and they actually encourage teen mothers to breastfeed. So I could actually bring my baby to school with me. So she'll come with me in the morning, and then I'll pick her up in the afternoon when school's finished. And during morning recess and lunchtime, I would actually breastfeed her. And that's when she could feed, and I could spend special mother-daughter time with her. The schools, they can talk to the principal, talk to the Board of Education, so they can actually establish a nursery so for the mothers to actually breastfeed, and they can complete graduation and be successful in life. Representing teen mothers in this breastfeeding symposium, I feel so glad and happy for myself. I hope I can inspire other teen mothers and just anyone else who can actually breastfeed, because breastfeeding is such a special gift you can give to your child, and it just gives you a very strong bond and a strong relationship with you and your child, and you'll feel better about yourself, and it's very positive, and you can just help your child in the long run.
That was a nice video for us to have an opportunity to watch. Well, here with us today are two experts from within the Department of Health. Our panel members have been and are currently involved in various activities that support breastfeeding. Immediately to my left is Heidi Hansen-Smith. Thank you for joining us, Heidi. And across, sitting from me, is Linda Chalk. Now, there's been a lot of movement on Oahu with Healthy Hawaii Initiative. So with the Baby Friendly Project or Baby Friendly Hawaii Project. Can you tell us more about that, Heidi?
Sure. We at the Healthy Hawaii Initiative really work on chronic disease prevention at the sort of higher level, policy change, systems change, really trying to make it easier for people to make the kind of smart choice around getting more physical activity, eating healthier, as well as choosing not to use tobacco. The project you're talking about, our Baby Friendly Hawaii project, is actually a project that we were funded through the Centers for Disease Control to look at the nutrition piece, which is breastfeeding, and at a more of a statewide level. So we're working with hospitals statewide to work on their practices around supporting mothers that are choosing to breastfeed.
So these are pretty amazing strides, I guess, that's being made within the state. Can you tell us a little bit more about the project, the Baby Friendly Project?
Yeah, that project, like I said, we're working with, we have 12 maternity care hospitals in Hawaii. One of our hospitals, Kaiser Permanente, is actually a baby-friendly designated hospital and have been since 1997. We're actually the second hospital in the nation to be baby-friendly designated. And really what that means is that they are working in their hospital using maternity care practices that are really considered best practices. And they've worked on the 10 steps to successful breastfeeding, which are these best practices in maternity care that really lead to supporting mothers that are choosing to breastfeed. And this is through a global initiative called the Baby Friendly Hospital Initiative that is through the World Health Organization and UNICEF. And so hospitals can work on these 10 steps and really work on changing their practices at, like I said, the systems level, so that the mothers that are choosing breastfeeding are really supported in what they do. And here in Hawaii, we have about 90% more of our mothers that are actually choosing to initiate breastfeeding when they give birth. And that's what we want to support at the hospital level. So if they are successful when they leave the hospital at breastfeeding, they're going to have a better chance as they move back into their families and communities to continue breastfeeding their babies.
Yeah, and I think that's amazing because the changes that we make, on a day-to-day basis, and the moms are making at the hospital as well, can really be affected by their environment. And so if the hospital policies and such don't support that, then the decisions to breastfeed or not, or to do combination feedings, can really be affected by that.
Exactly.
Yeah, and then the 90%, it seems like what happens, because initiation is when they start breastfeeding at the hospital, and then there's also the rates for duration, is like how long they breastfeed for, and then there's the degree of exclusivity. Do they just breastfeed or do they do both? So yeah, there's something that happens, I guess, with the numbers as well, because they don't quite.
Right. Well, I think what happens in, especially the exclusive rates of breastfeeding, and that's really what the gold standard sort of is with breastfeeding, is to exclusively breastfeed for 6 months. That's the recommendation. And what happens is that if practices aren't in place to really support the mother, then sometimes there is they're going to use some formula or something, and then once that happens, it's really hard to continue exclusively breastfeeding. I mean, basically, they're not exclusively breastfeeding anymore. And if that's what they really desire at the beginning, we want to support that as much as possible. And of course, sometimes there's medically indicated needs. There's definitely mothers that they're going to feed their babies no matter what, but we want to support their intent to breastfeed. And we do see really quickly right now that our numbers drop off, like you said, in duration and exclusivity. From the 90%, it goes down very quickly. And even though nationally our numbers of initiation are really high, we're still working on that duration and exclusivity.
Yeah, and so we just want to try to help, I guess, get rid of those barriers and challenges to make it easier if that is something that the moms are committed to.
Right.
Yeah.
Which is really great.
It's nice to hear that there's been also positive feedback from the maternity care hospitals. Can you tell us more about their response and their involvement?
Sure, they've been really great. In fact, even before we went into the hospitals, they're all working on this. They understand best practices in maternity care. They want to support their mothers that are choosing breastfeeding. And really, we went and talked to them when the project started, and we heard that a lot of their needs were around staff training. So they have great staff, but they want them all trained in the same thing. They want to be able to speak to mothers and give them the same information so that they're not getting a different message from different staff, the night nurse, the day nurse. And I think that was kind of across the board what they asked for. So we were able to, and we still are working on it, go in and really do some training with the staff. Almost all of the hospitals have been on board statewide, have sent a couple of their staff to sort of become these master trainers in their hospital, which gives them the opportunity to train the rest of their staff, and then also will sustain that training after our project is over, which is really what we wanted to see was, how does this continue? How do new staff become trained? And so we hope with these trainings and these trainers that that's going to really be continued in the hospitals.
I guess I'm interested to see or hear, perhaps, like if you have a pregnant mom who's due to deliver in a year, or maybe like in the next couple of months as well, what for the hospitals who are able to implement what they've learned in these trainings, what would that look like to the moms when they're at the hospitals?
Yeah, well, I think they're all working on that kind of continuum of care. So when they're getting prenatal visits, we hope that they're going to hear about the benefits of breastfeeding, and maybe also the other side, sort of what is the downside of feeding your baby other than breast milk. And then they're also going to hear that the practices in the hospitals are not different whether you breastfeed or you don't breastfeed, even that when your baby is delivered, you're going to have skin to skin with your baby, which is really important for baby and mother bonding and for the initial breastfeeding. And then after that you're going to be rooming in the same room with your baby 24 hours. Those kind of care that is just going to be established before they ever go into the hospital. They'll know what to expect. And that's really going to lead to supporting their choice if they're breastfeeding their baby.
Okay, that's great.
Yeah.
I know I remember seeing the video about skin to skin for the first time, and it was, mom gave birth right away, and then before they had cleaned off the baby and anything, measured, and they did, I think, very minimal of all that, and then they placed the baby on the mom's chest, and then the baby kind of did this little crawl, and I'm like, really, they're moving, and kind of made their way to the breast as well. That was part of the training that they received at the hospital.
Right, a lot of the staff does get that training, and most hospitals are really on board with that. And of course, that's a healthy newborn, and as quickly as possible, they do try and get the baby skin to skin with the mother. Hospitals are working on that with their cesarean babies as well. There is, a fair number of babies born by cesarean. Sometimes as early as on the delivery, in the operating table, the baby, depending on the situation. But really, they're finding that initial bonding is really critical for mother and baby, and that, like you said, babies really will just crawl right on up, and they have their little movements they go through, and it takes a little bit of time, but if you give them time together, typically the baby will find the breast and do an initial feeding. And sometimes I think mothers that even aren't planning on choosing breastfeeding will see that happen and be just amazed that it is what babies do.
Right. And really, ultimately, the infant feeding choice is the mothers, it's the families, and we just want to, be able to make sure that moms are able to make an informed decision and that they have the resources that they need if it's something that they would want to pursue.
Exactly. And I think something like skin to skin and rooming in, that's for all mothers, whether you're breastfeeding or not, but definitely making it so that it's, supporting the breastfeeding mom in every way. And then there's other ways you support moms that are choosing to formula feed.
Yeah. Well, we know we have some pictures that you documented, some of these activities, the trainings from locally and as well on the neighbor islands, yeah?
Yeah.
Yeah, okay,
We've had
so
all kinds of
got that.
events going on. And this picture is really one of our initial visits. We were working with the hospitals on Kauai, and some of the folks in that picture are from the health department on Kauai. They actually had some funding from the Centers for Disease Control as well. It was called Communities Putting Prevention to Work, and a piece of their project was around breastfeeding. And so we partnered with them. There's also some folks from the University of Hawaii School of Public Health Studies there, and they did some evaluation work for us. This is a team of trainers there's probably about 9 different hospitals represented here with a trainer in one of the train the trainer sessions we were doing. This was a recent one. This is another one of the trainer sessions we had. You can see they're all working hard. We took a curriculum that they had learned and really kind of cut it apart and put it together for Hawaii hospitals. And the trainers all took part in that and how it would really work best for the hospitals in Hawaii. And they're working together, all the different hospital trainers. This is a training that we did at Tripler. You can see the fatigues on those ladies. And our consultant, Carol Melcher, who's come and done about 4 visits to Hawaii and really done training with the hospitals, and you can see she kind of has the staff get right in there and do some hands-on learning about what she's teaching. And you can see the skin to skin on the board up there. That's what they're talking about. But she's been really great and did a lot of work with hospitals in Southern California and sort of become an expert at the 10 steps to successful breastfeeding and becoming a baby-friendly hospital, which is a designation hospitals can choose to have, and they go through the sort of whole process of making sure they're addressing each of the 10 steps, as well as the International Code of Marketing, which really they're going to not be accepting free formula. They don't give away free formula to breastfeeding mothers in hospitals. And so we do have some hospitals that are choosing to go that path and actually become a designated baby-friendly hospital.
Well, so glad that you were able to join us and share all these activities. I mean, it's a flurry of activities, really, it sounds like it.
Yeah, it's great. There's a lot going on, and really the hospitals are great, and everybody that's participated has given us great feedback.
No.
So thanks for letting me share.
Oh, yeah, it's great to hear the activities at kind of like the larger scale, the larger systems. And with us today is, Linda Chalk, and she'll be discussing some activities that focus more on the individual as well. Linda's here with the WIC program, which is very familiar to myself. It's a special supplemental nutrition program, and we provide core services of assessment for nutrition and health, nutrition counseling, and also resources for them to be able to buy healthy food at the store. So welcome, Linda. Thank you so much for joining us.
My pleasure.
Can you tell us a little bit more about WIC's involvement then with breastfeeding?
Yes, WIC has supported and promoted breastfeeding for many, many years, and I'm so pleased to be able to share some of the highlights of our breastfeeding efforts.
So you were part of the Kauai Symposium as well, yeah?
Yes, I did go and talk a little bit on data.
And some of the data that was shown, or that we have for the state of Hawaii, is very, very promising. I think it affirms Heidi's statement that 90% of our moms, or over 90% of our moms, initiate breastfeeding, and however, with the duration, it kind of drops off. Yeah. What would be different about, I guess, the clientele with the WIC program?
Well, the WIC program is specifically designed for low limited resource families, so you do have to meet income qualifications. So in that way, they're a little different from the general population. But we serve about half of the births in Hawaii, amazingly. And we currently have a caseload of about 37,000 people that we serve every month across the major islands.
Wow. Well, wow, because I work there, and wow, like it's a surprise. And one of the services that we provide to our moms are offering breast pumps. If you could share a little bit more about that.
Well, breast pumps are not necessary for every single case, but in cases where the mother might be separated from her infant, we do have a screening criteria, and so we do have electric breast pumps, hospital grade. We also have personal pumps that we are piloting, and also manual pumps that are available for anybody. Did you have samples of the?
No, we do have pictures of them. We have the electric pumps up on the screen. So
even an infant that's born prematurely and needs to stay in the neonatal intensive care unit, we can provide a pump to a WIC mom, and she can pump the milk and take it to the hospital and feed her baby that way.
Yeah, and it can be pretty pricey to rent it. It's I think a bit more economical to rent it. Definitely buying it is expensive, but this is a service that we provide free of charge to our participants.
Yes, and I think in our WIC program we have over 300, something like 400 breast pumps available.
Yes, and that has gone in circulation several times. So it's assisted more than one mom. Like each pump has assisted more than one mother and infant couple. I know one of the things that we do as well in the program is to offer breastfeeding incentives to just reaffirm what about their decision, and to just it's a feel-good, congratulatory thing.
So breastfeeding moms of newborns are available for different types of incentives. So in the beginning, we can offer nursing drapes, and I think the video of the Kauai teen mom showed her using a breastfeeding drape, and they come in they're made locally, so we support a local manufacturer, and they're very attractive. And they can also get nursing pads, and then at 6 months, they can get a sippy cup or a canvas bag, such as this. So lovely. And then at 1 year, they can get a picture frame. And these are small tokens of our appreciation and trying to affirm a mom's decision to do the best for her baby by breastfeeding.
Yeah, it's great. I know when I've counseled moms and given the incentives, they feel grateful, and they have, they might have had a bad day taking care of their babies, not enough sleep, and they get a nice little gift, and I think it's reaffirming to them of what the decision that they've made. Well, I think by highlighting these activities and programs, we've shown that there's a lot available to support breastfeeding mothers from the health department. So to all of you breastfeeding mothers out there, know that you have the support within the health department. And at the end of this episode, you'll see some links. So please feel free to click on them and find those resources to help you during this time and this special time with your baby. So thank you everyone for joining us for another episode of Foundations for Healthy Generations. And we hope you'll join us for part 2 of our focus on breastfeeding. Ahui ho.
Gotta get up. It's a beautiful day. Lucky that we live Hawaii. 24/7, 365. Swimming in the ocean anytime.